Hello, Living Word. I'm Dr. Frew from the PAAV staff in Sendafa, and during the last 3 years we have had a very productive and a very fruitful partnership with Living Word Community Church, and I'm really grateful and thankful for all the things you have been doing for the people of Sendafa. At the moment I'm standing near the home of one of our beneficiaries. The name of the lady is Teje. Teje is one of our microfinance beneficiaries and one of our HIV/AIDS patients. And when we started this project, we had only 8 HIV patients. At the moment, we have almost 300 HIV patients, and out of these, something like 10 of our HIV patients are benefiting from our microfinance project. Teje, when I first met her, she was very sick. She was bedridden. Her husband and her 2 daughters had died from HIV/AIDS. She was alone. She had no help, and she had finished all her money trying to find treatment. Now, when we found her, she was really sick, and she was discouraged. She was doing nothing. She had lost all her money, and we talked to her about our program, about our home visits, and we prayed with her, and we gave her some money to start to buy food and to help herself with. Then later, when we started the microfinance project, we gave her money, and she bought eggs and butter, cheese, and she started work with that. Now she has almost I think she has finished most of her, she has totally finished paying the amount she borrowed. She's in a very good state. She's very productive. She has grown in her faith. She's very happy to tell people about the project and the benefits she got from the project. She goes to church. She encourages other HIV patients. Actually, she has introduced me to several HIV patients so that we can help them also. She's a very happy person. She no more stays at home. She bought a cow. She also has a small garden here. She has one at the back. She grows cucumbers, cabbage, carrots, and she sells the eggs and butters. She's working from the profits she gets from the things she sells, and she's one of our good stories. Now I'm standing inside the Sendafa Maseret Christos Church, and the other thing we did is we bought keyboards to 2 of the church, and public address systems, microphones, and some electrical goods. And also last summer, that is July 2008, Living Word funded leadership training through Dr. Melissa for 2 elders from each church. When we started, there were less than 40. Now there are more than 100 people now worshiping this church. Okay, now we are inside the Sendafa Health Center. The Sendafa Health Center has a staff of a few nurses. There is no doctor, and every summer, and actually for the last 3 summers, we have had doctors from Living Word and nurses and doctors from Living Word Community Church, and every summer we treat more than 2,000 people for 5 days. When we started work here, there were only 8 known HIV patients. Now we have more than 270, something like 280 HIV patients. This is a room inside the clinic. It's a place where where the blood of the patients is drawn for HIV tests and for other tests. Okay. When we started this program, we had only 8 patients, and the reason was the people wouldn't come out because the society would reject them, and when we started the project, when Living World started funding the project, and we started with the testings and giving them food, people started to flock. They started to come because of the help they got. And when they knew that we could buy them food, we could have their blood tested, we could counsel them, then they started coming. And so if Living World hadn't funded us to buy those drugs and to have the CD4 tested, it would have been impossible for people to come to us and enter into the program and have the antiretroviral drugs for them. Yeah, if these people have not been, they haven't started the drugs, then they would have died. But nowadays they are healthy. Most of them are also working. They are taking care of their families. They are productive. They are profiting from the drugs, and Living World has helped us a lot with this. And as you know, we are planning to dig a water well in this community. This town has a really serious water problem. There's a big shortage of water, and one reason is when we started this project there were only about 9,000 people living in this town. Now there are more than 15,000, actually near 20,000 people. Right. So we are going to also install, Living World is going to install chlorinating units in the new well, as well as in some of the existing wells, so that the water will be pure and clean, and we'll have less and less waterborne diseases. Yeah, most of the diseases we see at the clinic, actually about 80% of them they come from unclean water.